Substance use and addiction is a growing concern among adolescents in India. 14 to 18 is the period where people tend to experiment on these substances. 1 in 2 to 3 Indian adolescents use this substance. Hello everyone, I am Dr. Venkata Lakshmi Narasimha. I work as Assistant Professor at Center for Addiction Medicine, Department of Psychiatry, NIMHANS, Bengaluru.
What does substance use disorder mean?
When people start using substances regularly, a number of changes happen in their brain, leading to something called as substance use disorder, which has a set of signs and symptoms. One of the major symptoms that happen or people show is loss of control over the use of substance. They have difficulty in terms of regulating the initiation of substance, continuation and usage of substance. People also develop salience over the substance, that is, they spend a lot of time in terms of procuring and using substance. Then people develop harms, despite that they continue using these substances. People also develop something called as tolerance, where the effect that is needed, people need to use higher amount of substance to get the same effect. Some people develop withdrawal symptoms when they don't use these substances. Also, people start getting intense urge to use this substance, which we call it as craving.
Why is adolescence a risk factor for substance use, and who is vulnerable to addiction?
Adolescence is a major period where people tend to start using substances because adolescent brains are in a stage of maturation. One is the gray matter which is in the brain develops or matures during this period, where the emotional circuits mature first, followed by the cognitive circuits, which means that an adolescent is more emotional during this period, whereas the brakes, which are the cognitive circuits, are not yet matured. So adolescence is a period where people are more impulsive. So because they are impulsive, this is a period where they tend to start using substances. Second thing that happens during this period is something called as synaptic pruning. For example, if you are good at something, your brain tends to mature that part of the brain more. So if you start using substances during this period, the memories of the substances stay for a long time and the chance of you getting addicted also increases. So because of these brain changes, adolescence is a period where you are at a risk of becoming dependent on substances.
What are the various medical interventions to deal with substance use disorders?
There are very good treatments that are available to help people with substance use disorders. There are medicines which will help to manage withdrawal symptoms. There are also medicines that will help to manage craving. And there are medicines that will help to manage the harms that people sustain because of these substances. There are also very good counseling techniques that the therapists use to help people motivate to stop these substances. When people are motivated to stop these substances, there are a risk of getting into relapse. To prevent these relapses, there are also relapse prevention therapies that are available.
What is the role of family members in prevention and treatment of substance use?
Once family is able to identify, it is important to know what is the reason why people are using these substances. For example, it could be related to stress, it could be related to bullying, it could be related to anxiety. So addressing that vulnerability, identifying and treating that is important. Finally, family needs to be aware that there is a help that is available, and it is also important to seek help early. Adolescence is a crucial period where a lot of brain changes happens. During this period, if you use substances, the chances of you getting addicted, also the harms due to substances are high. So the best preventive strategy is to not experiment on these substances during your adolescent period. Finally, if you have any problems with substance use, it is important for both individuals and families to identify it early and seek help at your nearest facility which offers help for people with substance use.